There have been a lot of changes and updates at Sumner Regional, so we thought it would be a good time to give a hospital-wide update and answer some common questions about how things are going here at the hospital and with the pandemic in general. So there is a lot of good news, first of all. After a very challenging, really 6 weeks, 8 weeks from Thanksgiving through the end of January, things are clearly improving. We hit a high at one point of 58 COVID inpatients, and unfortunately over the last 6 weeks, we've had a significant number of deaths as we've dealt with the large number of patients from that surge. But we are now down to around, well, we're averaging around 30 COVID inpatients. I believe the number is a little bit lower this morning, around 25 or 26. The isolation unit and the isolation floor are both still very busy, but definitely better than where we were. Now, the other metrics, our ability to transfer to other hospitals has improved. Throughout the state, we literally, like I said, the COVID numbers, the inpatient hospitalizations have been cut in half, so other hospitals are in a better place as well. And we've really benefited from the vaccine. We're now down to single digits of staff that are out on quarantine. So all of those things are better. The other thing that we follow is the percent of positive tests. And again, across the state, but definitely here and in Sumner County, that's better. We're down to low teens now. Again, by the metrics of the last 10 months, that's actually still not great, but it's better than where we were. So that's the good news. But we still have a lot of COVID patients, okay? And we still have a pretty high community prevalence. It's a lot better than where we were. But I think our challenge over the next several months, as hopefully things will continue to get better, is we need to maintain a high level of vigilance, okay? We need to continue wearing masks, and we need to advocate this for in the community. I've had a lot of people ask in the hospital, hey, at some point are we going to change the PPE policy because of vaccinations? And that's a great question. The short answer is no, not right now, and there's several reasons for that. One is there's still an open question of whether, even after vaccinated, we know that the vaccine is super effective at preventing symptomatic COVID infections. We still don't know if it prevents asymptomatic carriage or spreading of the disease. Also, related to that first reason, the CDC and our other national organizations, NIH, everyone is still recommending that. And obviously we want to follow the guidance of the experts. I'm sure a lot of you have seen this in the popular media. There's discussion about variant strains, the UK strain, South Africa strain, there's strains in Brazil, and actually there's a bunch of other minor ones. There are a fair number of people that think in the next month or two we will see a bump back up, predominantly from the UK strain. We will see. Thankfully now we are very experienced at adjusting operations. Besides wearing masks and social distancing, continuing to do those things that we've talked about for the last year, I would encourage everybody, both in and out of the hospital, to get vaccinated as soon as you can. I know there was a lot of discussion early on about concerns about the safety of the vaccine. We know it's very effective. Like I said, we've already seen the impact here in the hospital. As now millions and millions of people throughout the world have gotten the vaccine, the evidence of safety is excellent, okay? There have been rare cases of people having an allergic reaction, and plenty of people get an immune response, so you feel achy and sore, or maybe run a fever for 24 hours. Those things are very common. But the overall safety of the vaccine is really good, and it is clearly one of the keys to getting back to some level of normalcy. By and large, good news. Just continue to be cautious and be safe, and we will keep you updated as things progress. Thank you.